Sorry about that, everyone. My dog was not very happy that I was giving you guys more attention than him. We'll pick back up with the appendages of the skin. So the appendages of the skin include your hair and your nails. So we'll talk about both of those in the next couple slides. Um, this shows a big picture view of the hair. So um, it extends above the epidermis, and that's the hair shaft. And then you have the hair follicle, which is the sheath, and that's actually considered epidermis. So if you see the epidermis is almost this orangish color, that orangish sheath here is also considered epidermis, even though it drops down into the dermal layer. You also have the hair follicle itself. So that's that sheath, and it has the rich blood and nerve supply. So that's what's giving nutrients to the hair. The bulb or the root is where the actual growth occurs, and that's considered to be in the dermis. So hair follicle and shaft, epidermis, bulb and root, dermis. You have another one that's called the papilla. That's at the base, and that's a cluster of connective tissue and blood vessels that nourish the hair as well. And then you have your erector pili. That's actually a bundle of smooth muscle, and it attaches to the follicle. So when when it has a stimuli such as cold or some fear, your brain triggers your erector pili muscles to contract, and that makes your hair stand up. So that's what causes goosebumps. So they control the kind of if your hair's standing up or how taut your hair is. Moving on to the nails. So these are densely packed, heavily keratinized epithelial cells. So we talked about the keratinization of your stratified squamous epithelial cells in the epidermis. The nail is even more keratinized than these. Obviously, they're a good bit harder than your skin. So your cuticle, that's that fold of skin that kind of surrounds your nail and holds it in place. You then have your nail body, that's this visible part of the nail. Your lunula is this crescent shaped white, so think luna like the moon, crescent shape. And then you have your nail bed, and that's actually underneath the nail. So if you peeled your nail back, that reddish tissue is your nail bed. And the reason it appears pink is due to a really rich blood supply. Clinically, when we're trying to test someone's blood flow to an extremity, they do a capillary refill test where you kind of, if you squeeze your nail hard, it'll go white, and then you let go, and you can see that blood rush back in. That's what's supposed to happen. Your nail root is the proximal end of the nail. So remember, proximal is closer to the source or the body. And that's actually covered by your overlying tissue. This is where the nail growth itself occurs. So basically what happens is new cells that are keratinized are then added to the root from this nail matrix. And when the new cells are added, that kind of pushes the existing nail forward some. So our nails grow about 1 millimeter per week. And in general, our fingernails grow a little faster than our toenails. All right, we're going to just cover a few what would be considered disorders of the integumentary system. So acne, obviously everyone's heard of this one. So that's an inflammation of your sebaceous gland. So remember, that's that kind of lubricant that goes up to our skin and nails. And what happens is the follicle there becomes blocked with sebum. And so that's what creates your white head is that sebum. And then as that sebum, what's considered oxidizes, that's what creates a blackhead. So both whiteheads or pimples and pus or blackheads are sebum, just two different kind of forms. Dermatitis is just an inflammation of the skin. So anytime you see the ending itis, that means inflammation. And that just causes some redness and itching. Usually that's from kind of like a chemical exposure or a toxin. You then have eczema. That's an itchy red rash. Usually this is an allergy. And it has a little bit of a serum that oozes out. And when that kind of crusts over, that's what gives eczema that scaly appearance. Impetigo is a contagious bacterial infection, and that's characterized by yellow, reddish, weeping lesions. Psoriasis is a recurring skin disorder, and it has some characteristics that help it stand out and how we can identify it as psoriasis. It has these red papules or little bumps and scaly plaques, and they have super sharp, kind of obvious borders that go with them too. Again, it gives you that kind of scaly appearance. You have tinea, which is a fungal infection of the skin. An example of this is athlete's foot. So that's usually going to be in a moist area that kind of makes a good habitat for the fungus to grow. So athlete's foot is a good example to remember of that one. And then last but not least, we have urticaria. Again, this is an allergic reaction resulting in multiple red patches, which are known as wheals, that are intensely itchy. So I'm not going to test you guys big time on these. I just want you to remember the big characteristics, um, like the moist area, athlete's foot one. Like you should be able to identify that. That's kind of characteristic. Acne, that one, that's an easy one to be able to memorize and has an obvious characteristic of being that sebaceous gland. But don't get caught up in memorizing these words for word. I more wanted to include these because there's a little bit more of a clinical application for when you guys see these down the road. All right, I think one more practice question. So which of the following areas does hair growth take place? So is it A, the bulb, B, the follicle, C, the shaft, or D, the erector pili? And your answer is A, the bulb. So the follicle is the actual sheath which the hair is located, made up of the epidermis. The shaft itself is the portion of hair above the surface, and the erector pili is the muscle that controls our hair. So the bulb, also known as the root, is where the actual growth of the hair takes place. And I think that's our wrap up for chapter 6. And next we will move on to chapter 7. We'll talk about our skeletal system, the bones.